Welcome again to the Medical Terminology Podcast. This episode is Chapter 6, Part 5, Pathogenic Organisms and Oncology. In the section on pathogenic organisms, I don't think there's anything that's too terribly confusing. There's simply just a lot of information you need to study and learn. So what I'm going to do is give you a quiz over the items under pathogenic organisms so that you can check your studying. If you do fine on this, you probably are in good shape. But if you have trouble with this, it's something you need to go back and pay some attention to. First of all, what is a pathogen? Well, a pathogen is something that causes a disease in humans. It's a disease-causing organism. And there's several types of pathogens. What is the term for the type of pathogen that is a one-celled microscopic organism? Well, that's a bacteria. Bacteria. And what is the term for a plant or animal that lives on or within another living organism at the expense of that organism? That's a parasite. Parasite. And what is the term for a very small infectious agent that can live only by invading other cells? That's a virus. Virus. What is the type of bacteria that form chains? That's the streptococci. 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 What is the term for the type of bacteria that are rod-shaped and spore-forming? Those are the bacilli. Bacilli. What is the term for the type of virus that forms the disease known as shingles? That's herpes zoster. Herpes is Herpes, zoster, Zoster. And this is an acute infection that's characterized by painful skin eruptions that follow the underlying root of an inflamed nerve. What is the term for an acute, highly contagious infection that's caused by the rubeola virus and it's transmitted by respiratory droplets? Well, that's the measles. Measles. What is the term for a type of parasite that is transmitted by mosquitoes? That's malaria. Malaria. What is the term for a yeast infection? That's candidiasis. candidiasis. What is the medical term for the chickenpox? Well, that's varicella, varicella. And varicella is caused by the varicella zoster virus. What is the term for a type of medication that can inhibit the growth of or kill pathogenic bacterial microorganisms? Well, that's an antibiotic. Antibiotic. And what is the term for the type of agent or drug that destroys or inhibits the growth of fungi? Well, that's an antifungal. Antifungal. Also, it's called an antimycotic. Antimycotic. And what is the term for the disease known as German measles or 3-day measles? That's rubella. Rubella. What's the term for a viral infection that affects the parotid glands, which are the salivary glands? That's the mumps. MUMPS. What is the term for a disease that's caused by a small bacterium called rickettsia, and it's transmitted to humans by the bite of an infected tick? That's Rocky Mountain spotted fever. What is the term for a very serious condition in which the body is affected by an overwhelming bacterial infection, and the toxins released by the bacteria can produce direct tissue damage? Well, that's septic shock. SEPTIC shock. SHOCK. And what is the disease that's caused by the Epstein-Barr virus? Well, that's infectious mononucleosis. INFECTIOUS. Mononucleosis. MONONUCLEOSIS. And now let's go on and talk a little bit about oncology. That, for the most part, is straightforward. However, there are a few terms that are tricky, so I'm going to focus on those. Terms that are particularly difficult relate to the growth or development of tumors. If a tumor is in its original location, we refer to that as in situ. INSITU. In situ. Unfortunately, a lot of cancers can spread. And the term for the process by which cancer spreads is metastasize. METASTASIZE. This is a verb, metastasize. The cancer is metastasizing. It's the process of spreading. Now, that term is easily confused with the noun that refers to the spread cancer itself. In other words, it refers to the new location where the cancer has spread to. And the term for that is metastasis. Metastasis. That is a new cancer location. So when a cancer metastasizes, it forms a metastasis. Okay? Now, taking that one step further, it can form multiple metastasis. And the plural of metastasis is metastases. Metastases. Metastases is the plural of metastasis. And again, both those terms are nouns. They refer to the new location of a tumor. And the process by which these new locations are created is called metastasize. Okay, so you want to be very careful of those terms. Okay, and then just a couple other things to look at, and part of this is review from chapter 2. The textbook talks about different types of cancers and the tissues they affect. First of all, it talks about the carcinoma, carcinoma. And a carcinoma is a malignant tumor that occurs in epithelial tissue, epithelial. And do you remember way back from chapter 2, what is epithelial tissue? Well, it's the tissue that forms a protective covering for all the internal and external surfaces of the body. Now, there's a second type of cancer that's discussed, and those are the sarcomas. sarcomas. The sarcomas are malignant tumors that affect the connective tissues. And do you remember what the different types of connective tissues are? Well, we first of all have the hard or dense connective tissues. These are things such as the bone. We have soft tissue, and then we have the liquid connective tissues, and these are things such as the blood or the lymph. Okay, and one other little bit of cancer or oncology related information that sometimes causes trouble is related to the types of biopsies. First of all, let's talk about what a biopsy is. A biopsy is a procedure that's done to determine whether or not a suspicious mass or growth is cancerous or not. And the text talks about surgical biopsy. It also talks about the needle breast biopsy. And the goal is to just get a sample of tissue to determine if it's cancerous or not. The next step they talk about is sentinel node biopsy. sentinelnode, and then biopsy. Now, in this case, they're pretty sure there's cancer. They've already done the simple biopsy. They know there's cancer there. The question is, how far is it spread? So, in the sentinel node biopsy, they will use a test with some dye to determine where the cancer drains into the lymphatic system, and they will find the closest lymph node to the actual cancer site. And then they will check that lymph node. They'll take that out, see does it have cancer or not. If it doesn't, they can stop there. That sentinel node doesn't have cancer. The cancer is not likely to have spread any further along the lymphatic system. However, if they do find a cancerous lymph node, then they have to go further, and this is a lymph node dissection. In the lymph node dissection, they're going to take the sentinel node, and then they're going to go on and take the remaining nodes in a group to make sure that they do not have cancer in them. And they'll basically keep going until they find a lymph node that is clear. Okay, so now I'm going to go ahead and quiz you. What is the term for a cancer that is still in its original location? That's in situ. INSITU. What is the term for a newly formed cancer site that has spread from an original site? That is a metastasis. 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 Now, what is the term for the process of spreading? When a cancer spreads from its original location to a new site, the process of spreading is what? That's metastasize. METASTASIZE. What is the term for the type of cancer tumor that affects epithelial tissues? That's a carcinoma. CARCINOMAS. And what is the term for the type of cancer tumor that would affect the connective tissues? That's a sarcoma. SARCOMA. Now I'm going to make you think a little bit. You tell me which type of cancer is most likely to affect the following. How about the skin? Would that be a carcinoma or a sarcoma? Well, that would be a carcinoma because skin is an epithelial tissue. What about a bone? Well, that would be a sarcoma because a bone is dense connective tissue. What about the blood? Well, that would be a sarcoma again because the blood is a liquid connective tissue. Okay, and what is the term for a procedure in which a small piece of tissue is removed for examination to determine whether or not it's cancerous? Well, that's a biopsy. BIOPSY. And what is the term for the procedure in which a single lymph node is identified and then it is the only lymph node that is removed in order to determine whether or not cancer is spread? Well, that's a sentinel node biopsy. SENTINEL hyphen NODE biopsy, biopsy. And finally, what is the term for a procedure in which a major group of lymph nodes are removed in order to determine or stop the spread of cancer? Well, that's a lymph node dissection. LYMPH, node NODE, dissection is DISSECTION. Okay, well, that covers it for Chapter 6. Good luck to you with the rest of your studying and good luck on your test. This ends this episode of the Medical Terminology Podcast.